Why is anemia and CKD so often misunderstood? Imagine trying to solve a puzzle where some pieces are hidden or look similar to others. That's what managing anemia in chronic kidney disease can feel like. It's not just about low red blood cells, it's a complex condition with many layers. The main reason it's often misunderstood is because its causes and how it shows up are quite different from typical anemia. When the kidneys are damaged, they produce less erythropoietin, a hormone that tells your body to make red blood cells. Without enough erythropoietin, your body struggles to replace red blood cells naturally. But it's not just that. CKD also messes with iron in your body. Normally, iron is stored and used to make new blood cells, but in CKD, inflammation causes a hormone called hepcidin to rise. High hepcidin blocks iron from leaving storage sites and getting absorbed from food. So even if your iron levels seem fine, your body might not be able to use it properly. This makes anemia in CKD different from simple iron deficiency and harder to diagnose. Doctors often relying on blood tests like serum ferritin and transferrin saturation to check iron levels. But in CKD, ferritin can be high because of inflammation, even if your iron isn't available for making blood. Transferrin saturation might be low or normal, which adds to the confusion. This means that what looks like iron deficiency might actually be a problem with iron utilization, not just low iron stores. Because of these overlapping signs, it's easy to misjudge the type of anemia you have, leading to treatments that might not work well or could even be harmful. Another challenge is that symptoms like fatigue, weakness, or shortness of breath are common in CKD itself. So, recognizing anemia as a separate issue can be tricky. Plus, how severe the anemia is can vary a lot from person to person. Some people might have mild anemia, while others struggle with more serious symptoms. Doctors try to balance treatment carefully because pushing hemoglobin levels too high can increase risks like blood clots or heart problems. Treatments like erythropoiesis-stimulating agents and iron infusions can help, but they aren't perfect. Some patients respond better than others, and there are safety concerns that make doctors cautious. Despite evidence that treating anemia can improve quality of life and reduce complications, many patients don't get enough treatment. This can be due to worries about side effects, the difficulty of getting treatments like intravenous iron, or healthcare system barriers. It's also easy to overlook anemia because symptoms overlap with other issues in CKD, such as mineral and bone problems. All these factors make understanding anemia in CKD a real challenge. In the end, recognizing how complex and unique anemia in CKD is helps us see why it's often misunderstood. It's not just about low blood counts but about a web of hormonal, inflammatory, and metabolic changes. If you or someone you know has CKD, it's important to work closely with healthcare providers who understand these nuances. They can help tailor treatment plans that fit each person's needs and improve overall health. Always remember, managing CKD and its complications requires personalized care and expert guidance.